Hello, Buffy Stinchfield here with Pinnacle Women's Therapeutics. I'm a physical therapist, a women's health specialist, and I also specialize in treating the dancer athlete. There's a big overlap into female athletics as well. I treat a lot of women that are runners or CrossFitters, as there is a definite overlap into orthopedic injuries, hips, knees, as well as the other issues that we deal with like pelvic floor, and I treat all of that, and I help lots and lots of women with those issues. Today I'm making a video, and it's about hip strengthening. I've seen lots of discussions in the past, and I've got some friends in a running group that were recently talking about clinics on running form, and what would be a good use of your energy or focus on getting your running better and feeling better so that you aren't as susceptible to injury. And I think that running form is really important, and it has its place because if you haven't heard of runners before, running actually takes a lot of practice and training to do it right. It's not always inherent that we run just right. So running form is really good. But the problem is if we focus on where to put our foot on the ground, how to swing our arms, and we are completely lacking in good core and hip strength, that running form is not going to protect us, and it's not going to keep us running injury free. So I mentioned that to someone in a running group that I would do a video on what we actually need to do for runners, and actually pretty much anybody else that likes to bike, run. Gymnastics actually has the same issue, and that issue is the plane of motion that we move, or the plane of movement that we move in, is this nice straight plane of movement. You think about running, you think about biking, it's all going in this plane, not this plane of movement. And there's no rotation either in those sports. So you can talk about running, biking, a lot of gymnastics, tumbling passes, and the bars that they do goes just like this, just in this one plane of movement. So that's where true cross training comes into play. Not just pick a different sport, but you need to exercise and strengthen in a completely different plane of movement. And so I'm going to demonstrate just what I mean by that. I'm going to use a step. It's a 6-inch step. I'm going to stand on it, and I'm going to show you what this glute medius muscle does, and why it's so gosh darn important to focus on in your off time of running, and why training it becomes crucial. Before I demonstrate, I will tell you this. Glute medius weakness is pretty much epidemically weak for women and girls. We have to fight for this strength, because what we do in our day-to-day life in this civilization that we live in does not afford us any opportunity to train in this plane of movement. So here we go. I'm going to stand on a step. I'm going to show you what this glute medius muscle does and why it matters. Let's think about hips and knees here. So I'm standing on the step. And the first thing that the glute medius does, it does two jobs, is if I stand on one leg, which I'm doing right now, this lateral or side glute muscle is in charge of keeping my pelvis level. So if I turn off that glute medius or lengthen it, down goes my other hip, this one right here. If I tighten this glute medius, I bring up my pelvis, so my pelvis stays level, and the body loves to keep the pelvis level. Its other job is if I go down this step like this, and I'm going down that step, and if you can't see from the side view, what's really important is that as I go down with my hip going back so that my knee does not go in front of my toe. So as I go down that step, this thigh bone, think about it as a bone that can rotate like a corkscrew. Now, muscles can keep it steady and keep it from twisting. So if my glute medius is strong enough, not only can it keep my pelvis level as I go down this step, it can keep my thigh bone straight, or my femur bone straight. and it's not rotating. And what happens with a weak femur is the thigh bone, the glute medius cannot keep it straight, and as it goes down, the femur rolls in. And what you'll see from a person, or as you watch them go down a stair, if their glute is weak on the side of their hip, you'll see their knee come inward. Okay, it does not stay lined up with the hip, it goes inside. So that poor kneecap or patella, what happens to that is as the thigh bone rolls in and then the thigh bone goes like this, that poor kneecap gets pulled out to the side. So we can't blame the thigh muscle entirely for knee pain, patellofemoral pain, tendonitis in the knee, or just patella pain. We can't blame just the quad muscles. If the entire foundation of what this leg is on, that glute medius, if it's completely weak and that poor thigh bone's just rolling in, we're going to get knee pain. Now also, what do runners often complain of? Iliotibial band syndrome. So the side of their thigh gets really tender, it gets really tight, they're constantly trying to roll it out on a foam roller. They also get lateral hip pain and just hip pain in general. So if you think about the structures on the side of that thigh, if every time we land, because that's what running is, we're landing, and the knee goes in like this, even just a little bit, that's a big increase in stretch and a pull and a tension on the side. So the body's going to respond to that by getting tighter, and it's going to get sore eventually. Some people can skate away with just tight IT bands. Then other people, it will escalate to a lot of pain. So I hope that that makes sense and why you'd actually want to train your glute mediuses. There are lots of exercises that you can do. Unfortunately, Dr. Google has not caught up with glute medius strengthening. Even if you look at like Live Strong, his website, there's lots of good exercises. But they're just, Dr. Google doesn't do a good job of this. Just know anything that you're doing with your hips, if it's lateral, I can do a follow-up video for some exercises if that's requested. It's bread and butter of what I do in helping runners stave off injury, to get the knee pain better, get hip pain better. When we get this stronger, even back pain gets better for women, especially when they're over 40. So I hope that answered some questions and gave you some ideas for some cross training for running. And have a good day. Thank you.